Come and see the newly remodeled Freedom Village Assisted Living, which is open to the public. We offer a loving, caring staff who provide assistance with all personal care and medication management. Stimulating activities can energize your life here in a wide variety of inviting family areas, with an amazing menu created by our award-winning Chef Hugo. Call Freedom Village Assisted Living today and ask about our short-stay respite program.
And welcome back. Our segment about Freedom Village right now. They have been with us for many, many years, and we appreciate it. Joel is here today. Joel Niblett, welcome.
Thank you, Ken.
Nice to see you. You are the administrator over there, and you brought along Dr. Robel, excuse me. And you are an orthopedic surgeon. And people can see your jacket here with the logo on it. Right across the street here, South Coast Orthopedic Specialist, actually really right across the parking lot, and it's very easy to get to. But first, Freedom Village, which is up on El Toro, it's in Lake Forest. It's not far from here at all. I pass by it every day when I drive home. What do you offer as a community? There's really a lot more than just people choosing Freedom Village as a place to live. You've really expanded, haven't you?
Well, we have. Freedom Village is a retirement community. It's also known as a continuing care retirement community, or CCRC, and we provide all three levels of care: independent living, assisted living, and skilled nursing. So we have the independent living, which is predominantly the larger group of our residents, and then we have the health center, which makes up about probably about 30% of our community.
All right. And Doctor, tell us about South Coast Orthopedic Specialists.
Yeah, it's South County Orthopedic Specialists. Actually, we're a group of 9 board-certified orthopedic surgeons. We also have 3 physician's assistants and also a nurse practitioner. So there's 13 different providers that see patients. Actually, just before the interview here, we were talking, next year is our 40th year down in South Orange County. The group was started in 1974. Dr. Mullen and Dr. Baxick came from the Navy, and a couple of us joined him after that, but it'll be our 40th year. So we have a full-service orthopedic practice. We take care of every part of the body, backs and necks, wrists, feet, total joint surgery, sports medicine, all those things are included. We have our own physical therapy unit. We have hand therapy. We have digital x-ray, and full-service organization. All
right, very good. And Joel, the health center part of Fountain Valley, you offer a lot of amenities. I remember last time you were on, I was surprised to learn that these are offered to not just people who live there year-round. It's people can come up there and rehabilitate, respite program, bridge to home program. Tell us about all those.
Well, we are definitely open to the public, and that's a misconception that a lot of people have. So that includes our assisted living and for our skilled nursing unit. And what we do is we do have several different programs, which I'll touch base on in just a moment. But the advantage that we have in our skilled nursing specifically is the relationship that we have with Dr. Robel. So Dr. Robel and his group, a lot of the residents come through his office, and they come through skilled nursing. And Dr. Robel, we have the privilege to have Dr. Robel do rounds there weekly on all the residents, and I'll have him talk about that in just a moment in regards to maybe what the pre-surgery would look like, maybe a little bit about the surgical procedure, and then the post-follow-up in the skilled nursing setting. Okay. And then from there, we have different programs, which I'll share a little bit later.
So this is something that Freedom Village, one of the things that, the advantages that you offer here, working with local doctors. And when does someone consider an elective surgery on their hip or knee or something like that? Is it after years of pain, or they can't get around anymore, or when's the best time to do that, and how do you evaluate that?
Of course, with the population that we have down here, and also the population that's coming through now, it's a very active population. Most people are involved in something athletic, so we see lots of injuries. But in addition to that, the joints, of course, break down. Of course, surgery for us is a last effort for the patient. All the conservative modalities are started first. whether that includes medication, a change of the exercise program, injections into the joint, whatever. Once a patient is unsatisfied with their conservative modalities that aren't working, or they have an unacceptable limitation of their activities, and the x-rays, of course, show a deteriorating joint, then the total joint surgery is recommended.
Okay.
Before this, we were talking about the need for total joints is going to increase by hundreds of % over the next 15 years because of the population that's coming through.
Wow.
Yeah.
So people go ahead and they get this surgery, the procedure that they may need. How does Freedom Village follow up with the therapy? Do you have a therapy program there as well?
We do, and that's a very good question. The way that someone participates with our skilled nursing unit is they would either go through elective surgery or they would go through an unplanned surgery, which would be an emergency situation.
Mm-hmm.
Then when they arrive at Freedom Village, what we would do is we would develop a program with them, and we call it a plan of care.
Okay.
And from there, we would walk them through the therapy component, which we're very aggressive with the therapy. We want to start that immediately upon their arrival. And then from there, we graduate them out of the therapy program. If there's any other type of a chronic or acute diagnosis they might have, we also monitor and manage that while they're with us in the skilled nursing, with the goal of getting them to a place where they can confidently and safely discharge, back home to their environment. And again, I just can't stress enough that Dr. Roble visiting those residents definitely complements the care at Freedom Village. We have something that, a term that we use, it's called coordination of care. And what that is where we work with not only Dr. Roble, but we work with several of the other physicians very closely. We work with the families very closely. And a lot of times the families are the ones that have a lot of the questions because they're supporting and helping the resident as they come through. So we do a really good job taking care of the resident as well as caring for the families and then graduate them home.
Great. So people who have a surgery like this that come there, they may spend just a few weeks there, as opposed to residents who actually live there and go through the program, and that's what you mean by the bridge to home.
Yeah, correct. The Bridge to Home program is when someone is plateaued, when they've reached a level, they're walking a certain distance, or the therapists there feel like, well, that they're strong enough now to be off the therapy program, then we offer a Bridge to Home program, which is a 5-day program where they can pay for privately in our assisted living. When they move to our assisted living from the skilled nursing, we manage their medication, we do additional therapy, and then we graduate them from there if they choose to do that. And it really, it gives another alternative and another choice, and it really empowers the resident and the patient while they're with us to choose and kind of lay out their own path of what they feel is best for them.
Very good. It sounds like a great program, and who knows, their bridge to home may be Freedom Village, right?
Yeah,
it
correct.
could be.
Correct.
And you're undergoing a nice remodel there, I hear.
We definitely are. We're in the process of finishing that, and we just also finished a new Serenity Room. We had Serenity Room that we established, which basically is a private room that we offer to anyone that wants to have that type of a service and that type of amenity. So we've opened up an additional Serenity Room, and the remodel is basically complete. It's if you haven't come by yet, I can't stress enough, you need to come by and visit. We're always doing different programs, and I would encourage everyone to come by.
Very good. I appreciate that. And Freedom Village is, again, the address is on the screen there. It's on El Toro Road. And right up there in Lake Forest. It's not far at all, and you can give them a call at 472-4733. Whether you need some help with your knees, you can call the doctor here, or you just want to check out Freedom Village as a place for your residents. It's I've had a lot of people tell me how much they like it up there. So thank you both for coming on today. Very good. Nice meeting you. All right, folks, we're going right to our segment and with Age Well, and show you how to make a great summer salad.